Hi, this is Michael Giralli with Healthcare Genius and Bespoke Healthcare. And today we're fortunate to have Tanner Dobbs and Ben Light from Take Command Health to discuss ICHRAs with us. For most of you who subscribe to our YouTube channel, Healthcare Genius, we're always trying to find different solutions to bring to our employer clients and prospects and educate them on what's out there in the marketplace. So with that, I'm going to let Tanner start with the introductions, and then we can go from there to Ben.
Great. Thanks, Michael. So hi, guys. My name is Tanner Dobbs. I am kind of the director of sales here at Take Command. And often it's sometimes easier to think of account sales, what I do more as kind of an HRA design specialist team. And in that sense, what our team focuses on is, on the one hand, understanding compliance and regulatory. So from a national level and then, federal, state, local level, what are all of the rules around ICHRA and kind of this new opportunity in the benefit sphere? And then on the other hand, what we really focus on is the cost budgets that employers are targeting and benefits for employees. And so what my team does is we kind of look at all those dynamics together, and we work with broker partners and with clients to think about how do we design the best reimbursement structure that's compliant, but that also hits the kind of cost budgetary targets that you have, gives you the right cost control, and is giving your employees the right benefit. And so happy to talk about any of those items today.
Great. Thanks, Tanner. And Ben?
Great. Michael, thank you so much. And thank you for having us today. I'm the director of client success for Take Command. I come with a background from the broker world, and before that in the nonprofit world, where I actually sat on the side and managed health insurance for a small nonprofit. And what the client success team does is once Tanner's team hands off a group to us, we take over that relationship and put you in a position to be successful with your employees, to navigate through our platform, to understand all the different features that we can provide to make sure you're getting all the right reports and data, and that your employees are having a good experience as they're enrolling in coverage and then getting their reimbursement set up, whether it's for a premium or if you're allowing medical expenses as well. And then, of course, answering any questions that you've got and being there to support you as you get to know the ICHRA better and how it works for your employees.
Great. Thank you, Ben. And so Take Command has really been one of the leaders in this field, albeit it's fairly new, the field itself.
Right.
Do you want to just kind of give an overview of the company and the history?
Yeah, so Take Command is in our seventh year of life. It has gone through, early on, it went through a couple iterations, but in 2016, when the ICHRA legislation was passed, Take Command began focusing on ICHRAs and providing tools to help people administer those. So 2019, when the ICHRA was created and we found out that January 1st, 2020, you'd have your first ICHRAs in place, we rebuilt some of the logic and put ourselves in a position where we could administer ICHRAs for people in the same way that we were ICHRAs. So obviously becoming experts in the legislation and the rules, implementation, and then continuing to add features that were more unique to the ICHRA. So, we're coming up on the end of our second full year, just like anybody is who administers ICHRAs. But we have at this point over 2,000 clients, almost 20,000 employees on our platform. And we like to say that of the top 50 ICHRA experts in the country, probably 20 of them work for us.
That's great. That's great. That's a great overview. So, of course, we know our industry is full of acronyms. So let's start with, what is an ICHRA? And what does it stand for, and how does it work? I'll let whoever wants to take that one.
I'm happy to jump in. So we talked about ICHRA and then its predecessor, ICHRA. And so ICHRA is really just a qualified small employer HRA. And so, again, where the key facets of that, right, is that you have to be a small employer under a certain size, and there was a benefit cap. You couldn't offer more than a certain amount of money to each employee. And so then when the ICHRA was created, it's kind of the Individual Coverage HRA. And so those two big caps on the QSERA, it removed, it uncapped. And so in the first instance, it was for larger employers. So a lot of our clients are, what we would call ALEs, applicable large employers. And those are with 50 full-time equivalents who are subject to the employer mandate. So they now could use an ICHRA solution to satisfy that employer mandate, right? And so a lot of our clients are trying to find an ICHRA solution or implement an ICHRA solution to satisfy that. And then the second part is there's no longer a cap on the amount that you could offer. And so we see kind of across the board employers offering really, really generous benefits to their employees because there's no longer a cap on the amount. So yeah, Individual Coverage HRA. And just to say one last thing on the individual coverage, what it means is that it's an HRA or a reimbursement that can be used first for individual plans, right? And so those are any plans on the individual marketplace that are ACA compliant.
And one of the great things about the QSERA and the ICHRA is previously, if you didn't offer group coverage, but you said to your employees, just go buy something individual and we'll reimburse you for it, that reimbursement came through as taxable income. So your employees had to pay tax on it and you had to pay payroll taxes on it. What changed when these laws went into place was these reimbursements now become tax-free. So not only do your employees not have to pay taxes, but you don't have to pay payroll tax. So it puts you in an advantageous position when rather than a group plan, you're just saying to people, we're going to reimburse you. You just go buy that individual coverage.
Oh, that's great. That's great. And so we kind of got the differences between the ICHRA and the QSERA. So, what organizations or who are the organizations that can really benefit from these types of plans?
So Tanner, I'll jump off and then you can pick up at any that I forget.
Yeah, go ahead.
So with the ICHRA, and we'll focus on that to start, is there are a lot of different things that are going to make someone the right size or type organization. So Tanner talked about how ICHRA removed the cap on the number of employees. QSERA went up to 49 employees. Now with ICHRA, you can go to any size. So now there are no limitations on the size of company you can be in order to use this. But where it's really helpful are people who are coming off of group plans that they've had some bad claims, they've got a poor loss ratio, and their group carrier is offering them really high renewal rates. Because what ICHRA does is it spreads the risk over thousands of individuals who are enrolled in the individual markets. Therefore, it takes the risk off of the group insurance carrier. Or if you're in a self-funded model, and again, you've had a bad history, there's a great opportunity. Move to ICHRA, put the risk on the individual market. And because of the number of people enrolled, the rates don't have any sort of variability in the same way they would if it was just your plan. It's also a great solution for people who have employees in multiple geographies. And we know now with the pandemic still going on and many more people going remote, a lot of people are hiring all around the country. So what you're able to do is you can create classes of employees based on geography, and you can offer different amounts of money based on where someone lives because the cost of the coverage is going to be different. So you pick kind of a marker to go at and say, we want everyone to be able to afford 90% of the lowest cost silver plan in their market. And that way you give people equal buying power. So again, those are a couple of the examples of types of employers that really benefit when looking at ICHRA.
Tanner, do you want to add to that, or is that?
No, that we've recently at Take Command, we started doing this kind of ICHRA 201 webinar. And so we did ICHRA 101 over the last year, 18 months as it was new. And then what we found is that a lot of our broker partners who done the one-on-one, who have active clients on ICHRA solutions, they were kind of asking for more insights. And so 201 is talking about what we've learned the first couple of years. And on this point, when folks ask who does the ICHRA work best for, I think the emerging themes are a lot of what's been said, but it's two things. It's the first is around kind of risk mitigation. And so, I got an email from a broker a couple of days ago who was saying their CFO is just saying, I want to get out of the insurance game. right? They're tired of playing the game year over year, seeing the renewal, managing claims. And for some companies, especially in the really 50 employees to 2, 3, 400 range, a lot of times their leadership and their HR team just wants to get out of the risk mitigation game. They don't want to do it. And so an ICHRA is a great solution because rather than having to own and manage your employee pool's risk, you're actually shifting that risk to the community. And then with that bigger pool in the community, it's a lot easier to mitigate and predict what that's going to cost year over year. And then the second big benefit that we see is just around flexibility, is that the ICHRA is super flexible in terms of how you design the program for employees, the employer's ability to really target a specific cost, and then the employee choice, right? We've seen employees really, really like the ability to pick whatever plan they want, level of benefit that works for their own family, health benefit or healthcare needs. And then another benefit is that if that employee were to leave the company, they don't lose coverage. COBRA is not triggered. They actually, since they own the plan, they take it with them. And so we just, on that flexibility piece, we've seen employers and employees really, really applaud and appreciate that facet of this program.
And let me add just one final thing, Michael. One group of companies that we find are really successful with ICHRA are those that were concerned they would hit or would be unable to hit the enrollment minimums that you sometimes have with group coverage. So depending on what state you're in, you might have a 50 or 75% minimum enrollment in a group plan. With ICHRA, because they're individual plans, if you've got 50 employees and 3 of them want coverage, those 3 go and they get coverage, and you don't have to worry about any enrollment minimums. They get the coverage right away. So that, again, has been something, especially for companies that are offering insurance for the first time and they're unsure of how many people are going to want it. This is a really good solution because that enrollment minimum doesn't become a barrier for them.
And also, I think too, the part-time employees, where employers are struggling to find, employees for their workforce, but they have part-time. That's another area, right, where you don't have to meet some of the affordability tests if people are working less than 30 hours. So you can still provide an incentive for somebody. Is that correct?
Correct. Yeah.
Yep. What you can do is you can set classes in an ICHRA design, and so the most common ways we see folks distinguish classes are by state and then by full-time, part-time. And so what you can do is we can set a certain level of benefit for full-time employees and then a different level of benefit for part-time employees.
That's great. So now administration of this, right? I mean, if you're a large employer, obviously there's a concern of how are you going to administer this? How does this really differ from a group plan? If an employer's been on a group plan and now they move to an ICHRA, how does that administration work?
Yeah. So one of the things that we believe we have as far as best in class is our platform, the administrative platform that we have built that employers, the administrator of the plan, will log in, will have a dashboard where they have a ton of information available to them. It's really easy to add new employees. It's easy to remove them when someone has been terminated or has left. We provide regular reporting that will show here's who's enrolled in coverage, here's who you need to reimburse. It will show the fees you're paying to our company. It will give you all the information you need to administer the ICHRA. And with the client success team, you partner and make sure that you understand all the different features. We are constantly rolling out new features in collaboration with feedback from our clients because we want to listen to what are the things they want to see in the platform and how is that going to make their experience better. So we're really excited about where our platform is going and how it provides what we believe is a pretty seamless and low administrative experience for the companies who use it.
And when that comes down to, I know that early on reimbursement was kind of the model that, and probably still is for a lot of the smaller companies where the employee's actually paying the premium and the employer's reimbursing it. But I know that, that's changed, which you've created now. It looks more like group where you're able to do the billing for the group.
So what you're talking about is our new Autopay feature that is being rolled out this fall. And as you described, it is taking the reimbursement model and flipping it around and saying to employees, rather than you having to front the payment and then get reimbursed by your employer is actually going to make that payment. And if you spend more than the allowance they've given you, you'll just have a payroll deduction. So that feels very familiar and very comfortable for employees. Moving to ICHRA can be, there's some change management involved, because employees go from picking plan A, B, or C to having 50 to 75 to 100 different options. So there's some education we have to go through. The Autopay tool is one way that it makes that process much easier. It's something you don't have to now say to them, no, you pay, we reimburse you, because it looks exactly like that group experience.
And so when you put it all together, what makes Take Command, different from maybe other vendors, but from what we've seen, it's kind of an end-to-end solution, but I'll let you expound on that.
Yeah. So we really feel like we've got the best features that are available. The Autopay is the only feature like this that's out there with ICHRA administrators. We have expanded our team significantly over the last year in preparation of the growth of the ICHRA market. And we feel like we're in a position to provide not only the council with Tanner's team in how to design and create that ICHRA, but then also with the client success team, how we administer and keep those employees and employers happy, and then put people in a position where they're ready to make changes when it's time to renew, or we've got the data to come back to them and say, okay, you only spent 75% of your allowance. Maybe you should consider now offering the opportunity for people to submit medical expenses as well. Or maybe you could cut back a little bit on your reimbursements and give the money as bonuses. So we feel like we've got the people, the tools, and the data to really be best in class for ICHRA.
Great. So from an employer perspective, we know open enrollment is coming up. So many groups renew January 1. Are there some timelines, some dates? What's the process that an employer should be thinking about to get quotes and really be able to implement something for a 1/1 date, obviously, for a lot of those firms?
Yeah, Tanner, you want to go ahead?
Yeah, I'll start. So I guess step one is, if you are going to have a 1/1 start, which at this point, the vast majority of our current and prospective clients, that's what they're targeting. There's technically kind of regulation that says you need to make an announcement of that benefit 90 days in advance. And so that's where Ben and his team are sending out lots of announcements on October 2nd. And so to that end, for, large employers, if you're really, above a couple hundred up into the thousands, our guidance is that you should be evaluating your options right now and making a decision before October. So as long as you're coming to us, we're kind of reviewing the opportunity, we're discussing it and making a decision in September, then we're pretty on track to go ahead and start announcing, explaining to employees in October. And then, as you know, open enrollment would start 11/1. And so for a 1/1 start, the employees will be able to shop for plans traditionally 11/1 through 12/15. And so if you want to make sure that in advance you've set up the right program, your admins are prepared, and you're communicating to employees, you'd really want to do that in the month of October. So for mid-market and above clients, September is the time to be thinking about your options and making a decision, so that we can roll out in October and really implement in November, December. For smaller clients, we still work with clients between 50 and 150 FTEs through September and even the first half of October. There's still some leeway with them to be able to quickly look at it, quickly decide if it's the right solution for 2022, and then get kind of announced and implemented with employees. And so for our team, it's very much kind of crunch time in a lot of ways, in that a lot of our closest broker partners and kind of our biggest clients and prospective clients we're all talking about renewal right now. We're all preparing for 2022 right now. And so, one of the most exciting times of the year for us. Ben,
you want to add to that, or?
I would just say, everything Tanner said is right on. We want people to tell us as early as possible so we can make sure that from an administrative perspective and from an employee perspective that people have a good experience. They feel like they know what's happening. They've got all the information that they need to make decisions about what coverage is right for them. They don't feel rushed. So for us, it's always the sooner the better. If we have short timelines, we're going to work within them, and we're going to make sure we get you and your employees the coverage they need. But the longer we have, just the better the overall experience is.
And when you look at all the plans in the individual market, I know you've built a team really around communicating and helping to educate, and where once that open enrollment does start, employees are going to be able to go on your website and then call you, talk to your team about which plans might be best for them.
Yeah, so we actually this year are rolling out some really nice upgrades to the employee shopping experience. In addition to previously where you could enter your doctor and see is the doctor included in particular plans. We're adding a prescription feature as well, where someone will be able to see approximate prescription costs for the different plans. There's a great comparison tool. They will be able to see right within the shopping tool itself how much has been offered to them by their employer and understand whether they're picking a plan that their employer is going to pay for 100% or if they're going to have to add a portion out of their pay. So all of these things are really nice upgrades to the shopping tool if someone wants to just walk through it themselves. There's some nice filters they can apply if there are specific carriers or specific metallic levels of plans they're interested in. If there's someone who needs a little more support, our enrollment team is there for them, and they can schedule a call and be able to just get on the phone with someone, walk through and help to narrow down their options, which, I think a lot of people are going to need. But we've got a great enrollment team who's ready, and we will actually be able to, at times, if we do start early enough, carve out specific days and times that we would designate for a client to make sure that our enrollment team is ready to take calls from those employees.
And if an employee wanted to, I know one of the big things is some of your lower paid employees may qualify for subsidies, either on the exchange. They're able, which would potentially be better or better option for them. They're able to get out of or waive the ICHRA. Is that correct?
Yeah. So that, now we're really going to get into the fun part. And I know that, if people are still watching, this will be the part that'll help to get them to sleep at night. But there are rules around both the QSERA and the ICHRA with tax credits. With the QSERA, if you are given an affordable offer of coverage, you're actually not allowed to take tax credits and the contribution from your employer. But with a QSERA, if it's an unaffordable offer, so let's say an employer says, I'm going to just give everyone $100. If they get tax credits based on their salary, they can take those tax credits and there's an offset with what they get from their employer. With the ICHRA, if someone, again, gets an unaffordable offer with the ICHRA, they are allowed to then opt out of it, take those tax credits. And what would happen is if they do that, then the employer would have a portion of the shared responsibility payment that they would pay. So instead of the contribution directly to the employee, they would pay that to the government to help offset the cost of those tax credits.
And that's kind of where Tanner's team comes in, is really to help an employer figure all that out and make sure that, they're accomplishing the goals that they want to accomplish.
That's right. We work with the employers, but in Michael, my team was getting a demo of kind of the new software, new changes. And just yesterday we were being shown there's a screen where if I'm an employee, I kind of get this email saying, congratulations, your employer is offering you a benefit, click here to get on the Take Command platform and shop with that benefit. So once I click in, it tells me you're being offered $500. Let's shop now. And then one thing it asks me is like, can you please tell us your expected household income for 2021? Once I put that number in and then start shopping, the first thing it says, if I qualify, is Tanner, your employer's offered you $500, but based on your household income, you would qualify for $650 in terms of tax credits. Which would you prefer to take? And at that point, right, that's the guide for those employees to say, oh, I actually would rather take the tax credits, and it directs them accordingly, right? And so we do everything we can to make it very clear to the employees, to empower them to, because Michael, we're right now, especially during COVID, very, very blown away with how generous those tax credits have been. And so for employees, even high earning employees in certain geographies, they're being offered a really robust tax benefit. And so we just want to make sure they're aware of it and that they're taking it accordingly.
Yeah, and I think that and just to clarify too, if you're under 50 employees, that shared responsibility doesn't become an issue, correct? It's just the over 50 that you have to the applicable large employers.
Correct.
So, okay. Anything else that we haven't covered that you think would be beneficial or helpful to an employer who's looking at ICHRAs or QSARAs?
Yeah, I would just say if you want to know more, if you're interested in actually seeing our platform, reach out to our team. We'd be happy to do a demo. We'd be happy to talk through and take a look at a census. Tanner's team is fantastic at taking that census and understanding your goals as a company and how you want to put yourself in a position to provide coverage, be generous, be consistent across all markets for people, and we can run that analysis for you.
Perfect. And we will put a link to your website as well as some materials and contact information. So Tanner and Ben, thank you very much. Really appreciate it. It's been very educational. It's always helpful for me just to go through these again as well, because there's a lot of moving parts to it. But we hope that you find this beneficial. Again, you'll see on YouTube information down below that you can check out. And thank you and have a great day.
Thanks, Michael.
Thanks, Michael.